Hello. First of all, I want to congratulate to all those people who have cleared stage 1 INISS 2026 July session. So, believe me, you have done a great job. It's one of the toughest exam. I have gone through this exam few months back. So I can understand that you might be feeling that okay, now there is an interview, what to do about it, how to go about it, and you are just going from one contact to other contact to search that what all we can do, how to read and all that. You're confused. I can completely relate to you because I was there at the same stage 2 to 3 months back as so let me introduce myself so that you can relate much more with me. So myself, Dr. Nidhi Khar. I'm doing my DM residency from BMMC and Safdarjung Hospital in critical care medicine. I have cleared INISS January 2026 session with an AML rank of 14 and has been allotted AIMS Jodhpur CCM. Although I have preferred um, Safdarjung over AIMS Jodhpur due to my personal preferences. AIMS Jodhpur was a very, very nice college. So let's talk about what happens on the interview day and few days before the interview. So first you will be confused about how the interview will be taken. So I am telling you it would not be a face to face interview at all. You don't have to go anywhere. You have to sit at your computer and have to give a Zoom online. You will get a Zoom link and you have to give an online interview. So, nothing to panic. You don't have to go anywhere, don't have to come to Delhi for these interviews. So, this will be conducted completely online. So, now how you just got a list of few students who are selected for INISS interview stage 2 and you don't know how what to do after this. So, don't be confused. After few days, you will get an email from aimsexam.ac.in, Ames exam cell. For virtual meeting invitation, you will get a Zoom link, of course, which will be clickable. So that you will get the Zoom link and you'll have to confirm your acknowledgement. You have to click this link to confirm that you have received this email. So there will be mentioned a date and a time to join that Zoom meeting. So that would be completely online meeting, nothing to worry about it. So let's just see what what all they can ask, how will be your day of exam, and I would advise you few things which you can do a day before exam, on the day of the exam, and prepare accordingly. So try to be in a room where there is a good internet connection with your camera on and a normal white background preferably, and of course, dress professionally, although only your face will be visible in the camera, and be like in a professional attire. Of course, you all know that, and of course, you all will do it. So let's talk about what to do on the day of the exam. So whatever I got an email saying that your Zoom meeting would be on 12th of December, 3:40 p.m. So try to join this meeting, click this link on like 1.5 hours before the timing, because I have clicked this link. By my experience, I'm telling I've clicked this links 2 hour before, and 1 hour before they have let me in the Zoom meeting. So there would be 4 to 5 people sitting in a single room, and one would be joining from somewhere else, because these would be from AIMS and PJ Chandigarh and Jipmer, of course. Your faculty can be different. It should not bother you at all. So let's just see. I have given critical care medicine interview. So I can tell you something general also, and I can tell you what particular questions they have asked me in critical care medicine per se group. Okay. So there were four people sitting on the same circular bench, okay, and they were one by one. They would ask you the questions. So the first person, like things which you can prepare by heart, is your introduction. Okay, you never know which question they are going to ask you. You have already cleared INISS stage 1, so you have enough basic knowledge that don't panic that what would they ask, what would they don't won't ask. You will be confident you will be able to answer it. Okay, thing which you can prepare is just introduction. So prepare a good introduction. Like they will just first ask you, introduce yourself. So you should be able to introduce yourself, that where you have done MBBS from, where you've done PG from, and Just definitely mention if you have done some papers related to that branch which you are doing super specialty. That is, I have presented few papers and poster in critical care medicine conferences for critical care medicine. Although I forgot to mention it, but I found, and when I talked to many of my colleagues, you need to mention it if it is relevant, and then tell them that why you are interested in this branch, why have you picked for super specialty. Because even if you don't mention it, they will ask you back that why are you choosing this why are you choosing this branch as a super specialty. Okay, that is what you have to answer. That is what you can prepare actually. Okay. And then there will be first person who will ask you introduction. Now let me tell you what questions they have asked me in general for critical care medicine. First, they asked me to introduce, and the same person asked me about ARDS. What is the optimal PEEP? How do you check for PPLAT? And what is the ventilatory ventilator setting in ARDS? Then the same person asked me about sepsis and sepsis bundle. Is it applicable these days or not applicable these days? Then the mic goes to the second person. Okay. Then that second person asked me about brain death and how would you manage the patient who is already declared brain dead, and now you want to maintain his physiology until unless we retrieve his or her organs. That is what was the question. Then I told them about journal what all we will do, and then I talked about hormonal therapy. Then they asked me about what all hormonal therapy you have to give to brain dead person. So this is how they pick the question from whatever you talk about. So don't talk which you don't know about. This is the unsaid rule of all the interviews, of all the vivas we have gone through. All your seniors, all your colleagues, everybody consultant tells you don't talk about what you don't know. Just don't mention it. Okay. Because they'll pick your answer only and make a new question. You all know about it because you've given so many vivas and all that. Then the third person asked me early versus late CRRT. And he asked me particularly to mention single trial which support early versus late CRRT. So, of course, trials is an important thing. If in any subject, I'm not talking about critical care, in any subject, if there are some trials, there would definitely be some trials supporting some things. So you should at least learn. You know the important topics. Just say, I know the important topics of critical care medicine. I know that it is sepsis, it is CRRT, it is ECMO, it is ARDS, it is heart failure, it is COPD. So you can know at least one trial, because they will ask you to name just one trial of your choice. And they won't ask you anything about it, but just they want you have known something about the trial. Okay. Then this is what third person asked me. Fourth person asked me about like what all uh, management of malaria. They have given me a case scenario that so and so 34-year-old female came with liver function deranged, kidney function deranged. Can you give quinine, or you would like to give something else? What all investigation you would order? This was a clinical question. These all questions they have asked me in and all. Okay, it was not about question. First thing you have to remember, because there is a connection, there can be connection error. You can always ask to repeat the question very politely. Ki, ma'am, I didn't hear it. Ma'am, can you please repeat it? है ना? But don't do it intentionally. If there is a connection problem, then only do it. If you do it at every question, they will understand. Okay. Then try to see towards the camera all the time. Don't try to look here, there. They would feel that you would have like kept something, or you're seeing towards something. Don't be in a hurry to answer. Calmly, composedly, listen to the question, listen to the question, and then answer calmly. Okay. You can ask them to repeat the question. You can ask for few seconds to answer as well. They don't mind it. I have asked for it. I have asked, ma'am, can I get few seconds to remember? They have given me the few seconds, but that doesn't mean you'll take 1 2 minutes and you will keep on thinking. That's okay. And don't try to bluff. If you don't know it, say sorry, ma'am, I don't know it. They will ask you next question, or else they won't ask. or else they will not ask the same topic, है ना? So just don't try to speak something which you don't know about. Just try to be polite, be kind, and just try to be respectful. Okay, everything would go smoothly. I can understand you have a lot of apprehension about it, what all will happen, but it will. But I had a lot of apprehension. I have taken so many people number, none of them, none of them few of them picked up, none of them gave me a little bit a lot of idea about. Nobody, I didn't got anybody's critical care medicine number. Many of us are not from AIMS. So you might feel that it's very tough. No, it is not very tough. It is very simple. Whatever you have read throughout, you know a lot. If you cleared INISS stage 1 exam and have reached till interview, you know a lot. So try to be focused, calm. You will be able to answer. They will ask very basic, simple questions only. Do If you'll behave normally and be a little bit respectful and mindful, you will be able to answer almost all the questions. Don't And even if you have not answered few questions, don't be disheartened. This is all I wanted to tell you about INISS stage 2. If you want to ask something very specific about some problem, you can always DM me and at my Insta channel 1112 underscore iceberg, and you can follow me on YouTube channel at the rate medicine underscore at underscore ease. Thank you so much for listening to me. All the best for your exam, and you'll all do very, very nice. Very good.